Families of children in Tennessee with disabilities or complex medical needs are now close to getting access to a brand new healthcare program. It's called the Beckett Program, providing services or financial help for children who don't qualify for Medicaid due to their parent or guardian's income. The program just received federal approval earlier this month, and WATE 6 on Your Side reporter Jordan Brown spoke with two families today who say it is long overdue.
This is Shreve. He's 7 years old, loves Minecraft, Legos, and reading. He's come a long way since he was born.
He was born very premature at 26 weeks. He weighed a little bit over a pound. He was born because of severe preeclampsia. So he spent the first 9 months of his life in the NICU.
Due to his premature birth, Shreve lives with several illnesses that he'll have the rest of his life. Ever since he was born, his parents have learned the real cost of living.
I did total up recently, what would we owe each year for his care if we had no insurance, if we just had to pay everything out of pocket? I looked at the billing on everything, and it was $243,000.
A price tag too heavy for this family, and their insurance has been uncertain lately. The past few years have been a back and forth of them being covered, then kicked off unexpectedly.
It's an existential stressor that the shoe might drop at any moment. And we're fortunate in that we're employed, but there are thousands of families around the state who are in less fortunate situations, who are probably under the same kind of stress.
Families like the Petersons, they know and understand this stress as well. Their daughter, Tilly, was born with a rare genetic disorder that impacts her physically and intellectually.
She's in diapers. She's 12 years old. Regular diapers from Target aren't going to make it. You know, we have to have medical grade diapers. Those are an exclusion in any insurance policy. So out of pocket, we pay over $200 a month to provide diapers for her.
But that's where the Beckett Program will come in. Tennessee was the last state in the U.S. to approve it. It ensures children with special needs or disabilities can receive health coverage so families can focus on the priceless moments in life.
It's just a very exciting time to think about how, again, the things that she so desperately needs will be provided, but also how our lives as caregivers will be better, you know, to equip to take care of our children that need us so desperately.
And that peace of mind is something money can't buy. In Knoxville, Jordan Brown, WATE 6 on Your Side.
Jordan, thank you. And in a statement, the Tennessee Disability Coalition responds to the approval of this program, saying in part, quote, "The Tennessee Disability Coalition celebrates this achievement that represents the joint efforts of families, disability organizations, the Tennessee General Assembly, and state government. We look forward to the day we can celebrate an active, family-centered Beckett program that makes a meaningful impact across our state." And by the way, families can start applying for the program in a little more than a week now on November 23rd.